study CSF rhinorrhea. In this, CSF is coming from the nose. So there is discharge of CSF from the nose. What is the causes for the CSF rhinorrhea? The commonest cause is the trauma. Due to trauma, CSF can leak through the nose. Trauma due to accidental trauma. Trauma after the surgery like functional endoscopic sinus surgery, nasal polypectomy, transsphenoidal hypophysectomy, and skull base surgery. It may be due to the tumor like benign and malignant tumor invading skull base. Inflammations, mucocele of sinuses, sinonasal polyposis, fungal infections of sinusitis, and osteomyelitis which erode the bone and the dura. Congenital causes like meningocele, meningoencephalocele, glioma with skull base defect, and the dermoid. Idiopathic. So we can also remember that TTC. Mainly the causes of the CSF rhinorrhea is the trauma, tumor, and the congenital. Trauma due to accidental and the surgical procedures like functional endoscopic sinus surgery, nasal polypectomy, skull base surgery, and the tumor which invade the skull base. It also may be due to inflammation, and the congenital which is the meningocele, meningoencephalocele, dermoid, and idiopathic. Sites of CSF leak. CSF can leak through the cribriform plate, posterior wall of the frontal sinus, sphenoid sinus, also the Sternberg's canal. Signs and symptoms of the CSF rhinorrhea. There is watery nasal discharge. When the patient bends forward, this discharge increases because when bending forward, there is increase in the intracranial pressure, and watery nasal discharge of the CSF rhinorrhea cannot be sniffed back. Signs. There is reservoir sign or the teapot sign. Bending forward produces watery nasal discharge, which is called the reservoir sign and the teapot sign. We can see that reservoir sign. So there is reservoir of the CSF, but when we are bending forward, this CSF is coming through the nose. Halo sign, target sign, or the double ring sign. When the CSF is mixed with blood products, the peripheral CSF halo around the central blood. This is the central blood around the peripheral CSF mixed with blood products, which can be seen in the filter paper and the pillow cover. So, halo sign, handkerchief sign. Nasal discharge causes stiffening of the hanky due to the presence of the mucin but not of CSF. So, there is 3 signs seen in the CSF rhinorrhea: reservoir sign, halo sign, and the handkerchief sign. For the diagnosis, we do the high resolution CT paranasal sinuses, in which we can see the bony defect. Magnetic resonance cysternography can be done to see the site of the leakage, site of leak, to see the soft tissue. This is 100% diagnostic method of proving CSF leak. And the sites of CSF leak are the cribriform plate. Here we can see the sites of CSF leak. Cribriform plate, posterior wall of frontal sinus, and the sphenoid sinus. We can also see the beta-2 transferrin level. When there is doubt that this discharge, whether this discharge is the nasal discharge or the CSF leak. We can also, in CT cysternography, we do the lumbar puncture and there is use of contrast. But in MRI cysternography, there is no lumbar puncture, no contrast used, and there is no radiation. For the treatment of CSF rhinorrhea, if the CSF leak is due to trauma, traumatic, and it can also be due to spontaneous benign intracranial hypertension. When the CSF leak is due to trauma, then we first do the conservative trial, which is the bed rest. We elevate the head in to 45 degree, and we give the acetazolamide orally, which is the carbonic anhydrase inhibitor. And after admission to the hospital, we give mannitol to decrease the intracranial pressure. Avoid coughing, straining of the stool, and Valsalva maneuver, as it can exaggerate the condition for 4 weeks. And if this above method fails, then we do surgery, endoscopic approach, in which fat, fascia, muscle, septal cartilage, bone, fibrin glue is used to seal defect. Keros classification. This is used to see the depth of the olfactory fossa, and if the depth of the olfactory fossa is more, then there is more complication. So, in CSF rhinorrhea, firstly, we see the causes. It may be due to, most commonly, it is due to trauma, the accidental trauma, or due to the trauma during the surgery, functional endoscopic sinus surgery, nasal polypectomy, skull base surgery, transsphenoidal hypophyseectomy, and it may be due to the tumor. You can see trauma, tumor, congenital meningocele, meningoencephalocele, dermoid, neoplasm, and inflammation, mucocele of sinuses, sinonasal polyposis, fungal infections of sinusitis, osteomyelitis, which erode the bone and the dura, idiopathic. We see the sites of CSF leak. CSF can leak through the cribriform plate, posterior wall of frontal sinus, sphenoid sinus, Sternberg's canal. On signs and symptoms, we see there is watery nasal discharge on bending forward, which cannot be sniffed back. Signs, there is 3 signs: reservoir sign, halo sign, and handkerchief sign. Reservoir sign, halo sign, and the handkerchief sign. For the diagnosis, we do the HRCT paranasal sinuses, in which we see the bony defect, MR cysternography, and beta 2 transferrin. And MR cysternography is the 100% diagnostic method of proving CSF leak. For the treatment, firstly, we give the conservative trial bed rest, head in elevation to 45 degree. Then we give acetazolamide orally, then mannitol IV in hospital. We avoid coughing, straining of the stool, Valsalva for 4 to 6 weeks. Then if this above measure fails, then we do surgery, which is the endoscopic approach, in which fat, fascia, muscle, septal cartilage, bone, and fibrin glue is used to seal the defect. This is all about the CSF rhinorrhea. You can find these notes on the Telegram, and the links are given in the description. Thank you.